Hi lovers, welcome back to my channel. I am Nurse Adorable and welcome you back to Health Tips with Nurse Adorable. How are you doing today? Today I will be talking on how to manage diabetes. This is a continuation of the last video I made. The last video I made was on diabetes. So today I'll be discussing how to manage how to manage diabetes. So this video is for those who have been diagnosed with diabetes, or they are diabetic, they are at their pre-diabetic stage, or they have, if you have any relative who have been diagnosed with diabetes or pre-diabetes, or a friend or a colleague. So this video is for you because I'll be putting you through how to manage diabetes. So if you're in one of these categories that I have mentioned, this video is for you, and I would like you to watch this video till the end because it will be a very useful one for you. So before I proceed, I would like to welcome my new viewers into this channel. If you're watching me for the first time, I welcome you to Health Tips with Nurse Adorable. I am Nurse Adorable once again, and I welcome you to this family where we discuss about our health, and prevention and remedies are our priority. And please, if you are new on this channel and you have not subscribed to my YouTube channel, kindly do like my videos, share my videos, and your comment is important as well. And please turn on your notification bell so that you'll be notified whenever I drop a new video. Thank you. So today I will be talking on how to manage diabetes, just as I have said. So now let's move into discussing today's topic. So managing diabetes. I've said it in my last video that diabetes is when, just in a layman language, that is when the blood sugar in the bloodstream is above normal. It's above normal, and we know if it's above normal through some signs and symptoms like excessive hunger, excessive thirst, and excessive urination. And this can be ascertained by doing a glucose test. You can use a glucometer or other method at the laboratory. So now, managing diabetes, for those that have been diagnosed of diabetes or pre-diabetes, diabetes can be well managed, meaning that you can live long with diabetes. You can live a long life with diabetes if you are able to manage your diabetes adequately or effectively. It means that managing your diabetes effectively will help you to live long. And from my experience, I have people in their 80s now, some in their middle 80s or late 80s, and they have been diagnosed with this diabetes since their late 40s or their early 50s, and they are still living very fine because they adhere to their treatment, they adhere to their drug regimen, they adhere to their lifestyle regimen, and they are living fine. So that you have been diagnosed with diabetes does not mean the end of the world. It is not a death sentence at all. So it is important that when you have been diagnosed with diabetes, or you have been diagnosed with pre-diabetes, I said this, pre-diabetes is when the real diabetes has not been established. So but it leads to diabetes. So when you are in this category, you have to manage your diabetes very well. So if you are yet to watch my video on diabetes, the last video I made was on diabetes, where I discussed the causes of diabetes, the predisposing factors, that's the risk factors, the signs and symptoms, and the test, how to do the test, and the values that will make you to know that this person is diabetic or pre-diabetic. Talk about the types of diabetes also in that video. So if you are yet to watch this video, kindly do, because it will enable you to understand what it means very well, and it will also make you to understand this new video I'm making now correctly. So I'll be leaving will leave the link to that video at my description box. So you just go there, click on it, and watch the video. Also, I'll be dropping the other relevant link to my other videos that, like, I have made videos on living a healthy lifestyle, how to cope with stress, and all other types of I also made a video on hypertension and how to successfully manage hypertension. I made mention of it in my last video that hypertension and diabetes, they are like friends. So they are very common. Someone that is diabetic may likely be hypertensive. Someone that is hypertensive may also likely to be diabetic. So you need to watch these videos because they are very good for you in managing your diabetes adequately. So diabetes can affect almost every part of our body. Almost every part of our body. We're talking about our vision, our nerves, especially the nerves in our feet, the kidney, the blood vessels, and our heart. So it is important that when this diabetes must be well managed, because if not, it will affect our vision, it may damage the nerves of our feet, it may damage the kidney, the blood vessels, and the heart. So now, to manage your diabetes, you will need to control your blood sugar level very well. Ensure that your blood sugar level is not too high and is not too low, but normal. to ensure that your blood sugar is normal, is not too low. When your blood sugar is too low, that is hypoglycemia, and it is also very dangerous. And if your stomach can just go into coma, like because the person will be very weak, and you know the hyperglycemia is when the blood sugar is at the peak level, very high in the bloodstream. So when you are maintaining your when you're managing your blood pressure, you have to focus on your blood sugar level. So you make sure that it's not too high, it is not too low, and it is within the normal range. Also, you will need to manage your high blood pressure. If you're hypertensive, you will need to manage your high blood pressure adequately, and if you and also your cholesterol level. So these are the various things that you will need to consider while going through your treatment regimen. And you make sure if you have a high cholesterol level, you make sure it is being controlled. You speak with your healthcare provider, and they give you medications, and they also put you on other lifestyle regimen, talking about your diet, exercise, and everything that makes your cholesterol level to come back to the normal level. So another way of managing your diabetes is that always test for your blood sugar. Test your blood sugar level. So at times you may need when your blood sugar is normal, you may not really need to take in your pills, your medication, because it may bring it to a very low level. So you just need to monitor as you're treating your as you're taking your medications, and you're eating your diet, everything. You need to continue monitoring your blood sugar. So also in hypertension, you need to check your blood pressure. So if you smoke, you have to stop smoking. If you smoke, stop smoking. And then you need to have a diabetic plan meal. A diabetic plan meal will help you in guiding you on the type of meals you are to take and everything. So you can contact me for this diabetic meal plan meal. So I can plan a diabetic meal for you. So if you need one, contact me through my email has been dropped at the description box. So you contact me, and this will be given to you at a token. So and talking about a diabetic plan meal does not mean that you will not be able to eat your varieties again. So if your varieties fall into the categories of foods that you need to reduce their quantity, or you need to reduce the number of times that you take them, yes, we're going to consider your favorites in your plan, in your diabetic plan meal. It's just that you may not be having them in a big quantity, as a like big portion as you may desire, or you may not be able to be having them as often as possible. So you may have them less frequent. So another way of managing your diabetes is by doing physical activities, and the kind of physical activities that is very okay for diabetic patients is brisk walking, like you are walking very fast. You are not jogging and you are not running. So brisk walking is walking very fast at the same pace. By the time you do this, you see that you sweat and you are okay. Then swimming, dancing. I know dancing is very it's easy for us to do the brisk walking and the dancing. So in your house, maybe early in the morning, try to play some music, dance, and it's a form of exercise. Then playing of table tennis, basketball, climbing of stairs. Climbing of stairs helps diabetic patients. So there's also some things that you need to limit when you're managing diabetes. When you're managing diabetes, you need to limit fried food. Limit your fried food. Limit food that is high in salt. Baked sweetened food, you need to limit it. Candies, ice cream, alcohol, beverages with added sugar, such as energy drink. You need to limit the consumption of all those things that I've mentioned. And if you use insulin, your meal schedule may be like you're eating it at the same time in the day, like you are eating your meal before you take your insulin. Do you understand? The insulin, it must have been prescribed. Even other drugs, other anti-diabetic drugs must have been prescribed. You take in the morning, take after meal, so maybe some hours after meal, something like that. So now there are things you should take note while managing diabetes to prevent low blood sugar, which is known as hypoglycemia. Just as I've said before, you you need to be careful. That is, you need to prevent low blood sugar, because I've said it too that it's dangerous. So that means you need to be checking your blood sugar level, so that you will know when it is going to the low level, and you'll be able to maybe skip your drug at that time, or you take in something, a little portion of carbohydrates. So now, I talked about excuse me, please, physical activities as one of the things you do to manage your blood sugar level. So now, if what physical activities does is that it brings down the level of glucose in the blood. Physical activities bring down the level of glucose in your blood. So before you start, so at times, if care is not taken when you go into physical activities, it brings down the blood sugar level, and it may lead to hypoglycemia. It may lead to your blood sugar level to be too low. It may lead to your blood sugar to be too low. So it means that before you start an intense physical activities as a diabetic patient, you need to check your blood sugar. You need to check your blood sugar before you start an intense physical activities. You can even check it during, while you are maybe at the middle of your physical activities, and also after, so that we understand our body very well more. I mean, like when you, there are also some signs you'll be seeing. If you're diabetic, if your blood sugar is high, you already by now you should know the signs that you'll be experiencing, and when it's low you should know the signs you'll be experiencing. So you may need to stop and take your blood sugar level test. And also hypoglycemia, hypo, low blood sugar level, may occur when you skip meals. When you skip meals, it can result to hypoglycemia, especially those who fast. Fasting is not for those that are diabetic. It may bring down your blood sugar level and lead to something else, like you find yourself in a fainting state or in a coma state. So before you engage, just as I've said, in an intensive workout, check your blood sugar level, and you may need to eat some small carbohydrates, yeah, before, during, and after your physical activity. That is when you might have checked your blood sugar level before you start your physical activity. So you may need to take in some carb during, before, during, and after your physical activities. Then you take care of your feet. You know, I said it the other time that part of the body that diabetes affects is our feet. It affects our feet, and it may lead to diabetic foot ulcer. It may lead to diabetic foot ulcer. So you take care of your feet. Make sure that when you're going for workouts, your feet is well protected by wearing a footwear that supports your feet very well, preventing you from any puncture, injury, or any cut in your feet, and all sorts. So by doing that, we will be able to prevent diabetic foot, because what happens to the nerves of the feet is that they become damaged in a severe diabetic condition. They become damaged, the nerves become damaged, and that is sometimes when you have injuries. Some people, when they have injuries in their feet, as a diabetic patient whose feet nerves have been damaged, they will not experience any pain. They will not know that they've been injured because of the nerve damages because of the nerve damage at the feet. So it is important that we prevent all this from happening by controlling our blood sugar level adequately, and also our blood pressure and our cholesterol level. So now, other things you do is that you walk around in your compound. Walk around. If you're not doing brisk walking, if you cannot swim, if you cannot play table tennis or basketball, you should be able to dance. You should be able to walk around your compound, your environment on daily basis. You do that, you sweat, and by that your blood sugar level will be controlled. Then another method of improving your walking around is that when you are going for shopping, or you are going to for any visitation, you can park your car in a very far place and just decide to to walk to that distance you are going. Then take stairs instead of an elevator. Don't be lazy. So you go through the staircase instead of going through an elevator. Then do home chores. Don't be lazy. Do not be a sedentary person. Don't live a sedentary lifestyle. If you are diabetic, or you are at the pre-diabetic stage, do not live a sedentary lifestyle. Make sure that you are doing some house chores, because while you are doing some house chores, you are also shedding some like you are shedding out some weight if you are obese, if you are overweight, and you are helping your blood sugar level to be at the normal level. So when you are able to do all these things that I have mentioned, you'll be able to manage your blood sugar level very well. You'll be able to manage your diabetes effectively, and you'll be able to live long and happy. We all pray to live long. Just as I've said, diabetes is not the end of the world. I told you, I have many people in their late 80s, early 80s, and they've been living for diabetes and hypertension for, some people 20 years now, 30 years, and they are living fine because they are adhering to their medication. They are adhering to their medication, and they are doing well. So also their lifestyle, their meal is very important. If you are taking your medication and you don't have a good meal that supports diabetes treatment, you may be doing it as you may be taking that drug as if you're not taking anything. So everything works together: the physical activities, your planned diabetic meal, and also your medication. They work hand in hand. So it is important that you put all these things that I've talked about into consideration as you manage your diabetes. So you can drop your questions at the comment section, and you can also make requests for the topics you would like me to discuss in this channel. You can make requests of them at the drop it at the comment section, and you can also consult me for personal consultation on your health matters. You need health advice consultation, just feel free to discuss with me, to contact me for that, because I have dropped my email address at the description box. So try to speak with me one-on-one, and with God and yourself, your corporation, we will be able to help you through your through whatever you're passing through health wise, and you'll be fine. So this is all we'll be having in today's health talk. So this is all we'll be having, and if you have enjoyed this video, kindly give it a thumbs up, and click on the subscribe button, like my videos, share my videos, and please do not forget to turn on your notification bell. Thank you for watching. I will see you in my next video. Live healthy and stay safe. Love you all. Bye.